Today, as Tom just mentioned, I want to discuss a serious challenge because it affects every single citizen, the health of our entire economy, and our country's ability to maintain the leadership position we have had in the world. This is a challenge that's urgent in the need to reform and modernize our entitlement programs, primarily Social Security, Medicare, and Medicaid. These are safety net programs that we have enacted as a country, as a compassionate society, to care for the elderly in retirement, for people with disabilities, and for those who cannot afford health insurance on their own. We need to fix these programs so that no seniors, now or in the future, will ever have to question whether they can get the health care they need or the Social Security benefits that they have earned. We need to fix these programs because if we don't, they will consume every dollar the government collects. There will be no money left ever to improve our schools, defend the country, clean our environment, repair our roads, bridges, or anything else. We need to fix them so we don't keep adding trillions of dollars of debt or pay increasing amounts of interest on that debt. Why do these programs need fixing? First, because Americans are living longer, and I think we all like that. That, of course, means they're drawing more total benefits over their lifetimes than these programs were ever designed to pay for. Because longer lifespans are being driven by healthcare innovation, that contributes to the increased cost of both healthcare and entitlement programs. And because Americans have had fewer children, which means, relatively speaking, today there are fewer workers paying into these programs compared to the growing number of beneficiaries. We must very simply have a vigorous debate on how to fix these programs. But before we can even get to that point, as Tom said, we first have to convince America that these programs are in trouble, there is a problem, and they need to be fixed. The evidence clearly shows that as we know them today, they very simply will not and cannot survive without restructuring. Yet, according to public opinion poll after opinion poll, most Americans are not prepared to accept that reality. So what we hope to accomplish is simply to get the truth out, to start the debate in earnest, to pave the way for action sooner rather than later. Entitlement programs are not self-funding and are a main driver of our nation's deficits. That, by the way, has been true since their inception and remains true today. In 10 years' time, the total price of these programs is going to soar from $1.6 trillion to an astounding $3 trillion. Longer life expectancies, changing demographics, and soaring cost explain why entitlements as we know them today are unsustainable. In fact, it won't be long, think of this one, before about a third of all Americans will be retired and then spend 1/3 of their life in retirement. If people were to live in retirement for the same number of years as they did when benefits were first paid out in 1940, a person would retire at age 76 today. Not a single major entitlement program, let me repeat that, not a single major entitlement program is projected to be solvent in 20 years. The cost to make these programs financially solvent for the next 75 years, which is how the trustees look at it, is roughly $40 trillion. Paying that kind of price would simply bankrupt the country, cripple our economy, rob the new generation of young people of the promise of the American dream. Mandatory spending on entitlement programs and interest on the debt are already squeezing out all other federal programs. In fact, mandatory spending today actually exceeds all federal income tax revenues collected. We have to borrow money and we have to increase debt literally to finance and pay for everything else in the federal budget. We have nothing to fear here from carefully crafted, phased-in adjustments to these entitlement programs. America's entitlement programs, in fact, have been adjusted and modernized many times over the years to keep up with demographic, economic, and societal changes. No one in our mainstream political system is talking about cutting the amount of money spent on entitlement programs. What is being discussed is the compelling need to restrain the rate of increased cost to make these programs sustainable. The biggest single threat imaginable here to all of these programs, Medicare, Social Security, and Medicaid, as we know them, is if we do nothing. Entitlement reform, very simply, will not succeed as long as the conversation nationally is dominated by overbearing voices, if you will, of denial and distortion. With reason, facts, common sense, and quiet urgency, we hope to begin to try and change that conversation by telling the American public, very simply, the truth, their truth. That's why we at the U.S. Chamber are launching a comprehensive communications and outreach campaign underscoring the urgent and imminent need for entitlement reform. Strengthening and improving the nation's core social insurance programs are not insurmountable problems. They are achievable goals. We need and must have a national conversation, not a filibuster, a conversation that leads to the understanding of and drives us to swift action. So help us get the truth out. Let's start the debate. Let's find the right solutions. Let's create an echo chamber for action. And the best time to start that is now. Thank you very much.